So I'm getting an FUE procedure with Dr. Sean. What brings me in today is I've had like kind of like higher, like on my hairline, it kind of goes back on the sides further than I would like. So what they're gonna do is they're gonna take some hair from the back and put it around here. And it's something I've wanted for a long time, and I was just putting it off, and I imagine I could kind of feel comfortable with it eventually if I decided to, but this is a really good option. I haven't had any hair loss. This is kind of how my hairline has always been. As a trans woman, I feel like it's kind of a more masculine feature, and so sometimes when I look in the mirror, I see that as like, it just kind of reminds me of like my old self, and it's something that I think would give me a lot more confidence if I just had like a more stereotypically, I guess, like more female hairline. I know gender is you know, a spectrum, and there's all sorts of genders. It's not just male and female, but for me, when I look in the mirror, you know, I wanna see as much like female qualities as I feel on the inside, on the outside. So I feel like this is an awesome opportunity to kind of see more of what I feel like. You know, I often like to wear my hair up, so I'll like put it back like this, and you know, I feel like if there's more hair here and here, it'll just be like a more kind of like more feminine, delicate feature, I guess, as far as just like, it's just like it's a typical like male pattern. It's hard to talk about this stuff when like, you know, there's more genders, just male and female, but for me, it gives me like a, it makes, how do I want to say this? Over the years, I've kind of tried to make peace with, you know, my hairline being the way it is, because it's also fine the way it is. But like, there's often times when, you know, I'm doing my hair and I want to wear it a certain way. Like I want to pull it all the way back, or I want to do like a side swoop or something. And it's just, I feel like, you know, for me and how I feel on the inside, which is like more on the female side of the gender spectrum, it's not what I see in the mirror, and it gives me like dysphoria, which essentially it just makes me feel like the gender that I was assigned at birth. And you know, it's been a journey through hormones and surgeries and things to make me feel more at home in my body. And you know, I remember as I was starting to transition years ago, and I started to see, you know, my features become more female and more of what aligned with how I feel on the inside. It was like a coming home, and I would look in the mirror and I'd be like, oh my God, like I see in the mirror what I felt for so long. And so I think, you know, going through with this procedure is gonna make me feel even more at home in my own body. And so, you know, like just having like a more typical like female hairline and having, you know, more hair down here and here, I think it'll just you know, give me that kind of confidence, and yeah, it's something I wanted to do for a long time. I guess it's just like, you know, the parts of ourselves that we're so insecure about, we're more aware about than other parts of ourselves. So, you know, I think when you know, the hair starts to grow and it's like becomes my hairline, I'm just gonna feel more just like comfortable and confident, like, you know, swimming or something. When I come out of the water and all my hair is back, I'll know that part isn't how it used to be, and I'll just feel more comfortable. The wind is blowing it, or, you know, I want to wear my hair back in like a sleek bun or something. Like it's just gonna, yeah, I'm looking forward to that. I'm looking forward to that a lot. I haven't tried anything else. My friend recommended a product, but the product that they recommended only works for hair that used to be there. And since I never actually had any hair, you know, here in the corner, I don't think it would work. So yeah, I did like, I did take like some eyeshadow and like put it along here just to see maybe what it would look like after this procedure. And just doing that, I was like, oh my God, that's gonna like feel better to me. Dr. Sean's been really cool through this whole process, for sure. Just like communicating with me and like telling me what was gonna happen and what to expect. I found him, I believe, this was like a couple years ago, but I found him just searching online for Los Angeles, you know, doctors who do this. And I came in for a consult and immediately I just felt really comfortable, and he, yeah, he was just really like present and there, and he was like, how can I help you? This is great, da da da, you know. So pretty much like right away I was like, okay, if I'm gonna go through with this, like I want this guy to do it. Yeah. I do know it's like a few days of aftercare for sure. Like I'll have to sit upwards when I sleep for a little while and like spray some like protein water on my hair and make sure like all the little, you know, new baby hairs are well taken care of. Yeah, I'm not sure like I know he's still gonna go over that with me, like exactly how to do the aftercare, but apparently like in a few weeks the hair follicles that he puts in will fall out, and then in 4 to 6 months after that the new hair will start to grow, and in about a year I'll have like hair that's there. I'd say like whatever you need to do to make yourself feel more comfortable in your own skin, like go for it. I think like a combination of like just like self-care and self-love practices with like altering something in your appearance, if that's what you feel like you want to do, that's like your given right to do what you need to do. This specifically, like I haven't been through it yet, so I can't like give like a full recommendation for it, but looking at how others have come out on the other side of this, like I think it's gonna be great. And I would say like, you know, doing anything like this has it's a little scary, but you know, I think it's worth it, and like you're worth it, and yeah.